Hi guys, Dr. Sammy, thanks for joining us. We're going to talk about our felids today, our cat patients, our felines. And something we've been seeing a lot of lately is feline pancreatitis. It is not only for your dogs, but it is for your feline patients as well. Congratulations. Hopefully you don't get it, but it's very, very common. So feline pancreatitis, guys, we used to not think felines got pancreatitis near as much. In my experience and kind of what I see, a lot of veterinarians don't look for it, therefore they don't identify it and treat for it. We run a lot of feline pancreatitis tests and we get a lot of positive feline pancreatitis tests. So what is pancreatitis? Pancreatitis is an organ that goes from right side of the abdomen, crosses it, and then down the left side. It does attach to some GI tract and kind of goes along the base, kind of the stomach. It's more something called the transverse colon, but a little more medical lingo than what most of us are looking for right now in this purpose. But it's an organ, like I said, that crosses the whole abdomen, and it's called the pancreas. When that pancreas gets inflamed and irritated, it releases some of its digestive enzymes. So the pancreas is an organ whenever we eat, drink, people, dogs, cats, whatever species that has a pancreas, it releases enzymes to help digest that food, and it releases it into the GI tract typically, kind of in the beginning, somewhere called the duodenum. And when the pancreas has pancreatitis, itis is another word for inflammation in the medical lingo, and inflammation typically leads to leakage, inflammation, swelling, things of that nature. When you have an organ that releases digestive enzymes that is inflamed, it leaks those digestive enzymes into the surrounding area, or at least pisses off whatever it touches. And in our case, touches the small intestine, it touches the kidneys, it touches the liver, the stomach, and then some more intestine over here as it goes down. Pretty much it touches a lot of different things in that abdomen. And that's why pancreatitis in dogs and cats can cause so many different issues. We can see kidney elevations, liver elevations, GI issues, vomiting, anorexia, lethargy, and the list kind of goes on a little bit. So hopefully that makes a little bit more sense for you guys now and why that happens, because the pancreas is very close to most of those organs. When it's inflamed and irritated, it pisses those organs off and they're not happy. So that's when typically owners will bring them in. For cats, we do treat them a little bit different than dogs. Every doctor will do things a little bit different. They are not small dogs, so treatment is a little bit tweaked for them. Here we do a lot of fluids, some anti-nausea medications. I'll use an anti-inflammatory. Every now and then I'll tweak it up depending on the patient, and pain management. So most patients respond really well to what's called outpatient, so injections, sub-Q fluids, things where we give them shots and pokes and then we send them home. Some patients require a little bit more and need to be hospitalized. The vast majority of those patients do very well. Every once in a while I'll have a very stubborn pancreatitis patient and they will be stubborn little son of a guns. And usually we'll have to hospitalize those guys for a few days, sometimes a week or two, or they'll do great and then kind of relapse, do great, relapse, kind of just this back and forth thing. I personally don't see that frequently, but I do have a handful of cases every year that I do deal with that. And it's a little annoying and frustrating for kind of everybody. Staff, owner, me, patient. I like to see them when I treat them get better and do well and stay better. The reality is it's medicine, it doesn't always read the book, a lot of gray areas, and things do what they want sometimes. But hope that educates you guys a little bit, and hope that was something useful for you feline owners, and you can extrapolate some of those things to the canine world as well and a lot of other species. So hope that was useful, guys. See you next time. Bye.